Hello, friends. So, today's case an 18-year-old girl presents with fever, painful urination, and urgency. She is sexually active and has had intercourse within last few days. Clean catch urine culture after 24 hours demonstrate 2 lakh colonies per ml of gram-positive cocci, which is catalase positive and coagulase negative, and no bias and resistant. The patient is started on cotrimoxazole. So, what is the most likely diagnosis and what is the causative agent? So the diagnosis is lower urinary tract infection that is known as cystitis, which is very indicative from the fever, painful urination, and the urgency. And causative agent is Staphylococcus saprophyticus, which is the most common cause of cystitis among young women which are sexually active. Other causes is Escherichia coli. Now let us understand its pathogenesis. So these bacteria, they are perennial skin flora, and bacteria enter urinary tract by sexual actions, and it causes infection and inflammation in urinary tract and then spread to urinary bladder, causing inflammation of urinary bladder, which is known as cystitis. What are the investigations that you should order? Clean catch urine culture and sensitivity, that is showing the growth of gram-positive cocci in clusters which are catalase positive and coagulase negative, that is coagulase negative staphylococci, which is novobiocin resistant, that is most likely Staphylococcus saprophyticus. Which treatment you should do? You can give cotrimoxazole, that is combination of trimethoprim and sulfamethoxazole. I hope you like this case-based medical microbiology series. Do subscribe to the channel for regular updates and video posting for the topic. Thank you.